The role of the advocate is to ensure that people have got enough information to ensure that they're able to make decisions and choices for themselves.
Help people understand their rights and to represent them in relation to service providers, to their doctors, to their care coordinators, to their CPNs.
My job is also to make sure that they feel that no matter what anybody else says, that there is somebody who is actually by their side and actually is going to vouch for them and speak on their behalf if they wish to. And in a sense, the advocate, my job is not to judge what that is, it's just to support that person and make sure that they get their wishes and their opinions heard by other professionals.
Advocacy is not a befriending service, it's there to provide representation, information about rights, helping people understanding not only their own rights but the rights and powers and duties of the service providers who are working with them.
A person's right to have an advocate is a decision that they make. You know, somebody may say, look, we think it's a really good idea if you see an advocate, but it is up to the individual, and I make it really clear that they don't have to see me. I will introduce myself and introduce them to the job that I do. But if they don't want to see me, that's fine.
It is about issues, so it's about helping people to resolve an issue, and then the advocate stops. So it's not an open-ended process.
One of the roles of the advocate is to address the power imbalance between the service user and the professional they're working with. Those professionals might be empowered to make decisions about treatment, for example, and the role of the advocate would be to make clear to the professionals working with that individual what their views are, or to support the service user or that individual to articulate what their own needs and desires and wishes are.
You know, that sometimes there is a reluctance from professionals to listen because they hear it all the time, that they don't like my medication, it's not making me feel very well, and I think sometimes professionals don't listen or believe the patient.
If people are subject to the Mental Health Act, for example, they are entitled to access what's called the Independent Mental Health Advocacy Service, or IMHA for short. Most hospitals or inpatient units should have information about your local IMHA service. Indeed, if you're in the community and you want to access an advocacy service, then you should be able to do that by contacting local mind associations and finding out who's running that particular service and how to contact them.
And at times we're all less able to speak up for ourselves, feel less able to get the things that we need at the time that we actually need them. We all need advocates sometimes, all of us.